we're getting closer to the first phase of the COVID-19 vaccine distribution. With a weapon against the virus on the horizon, people have a lot of questions. So WMAR2 News' Eddie Kadam is live at the University of Maryland in downtown Baltimore tonight. Eddie, you had a chance to talk to some legal health experts about the vaccine. What are they saying about the distribution?
Hey, good evening, Kelly. A lot of people are wondering, can my job make me get the vaccine? And with such a short supply, who's going to get it first?
The United Kingdom will start distributing the vaccine from Pfizer next week. Here across the pond, the FDA will hold a panel next week to decide when to roll it out in the United States.
Here, there's an effort, I think, by the organizations, both the national academies and CDC, to actually try to mitigate health disparities and really look at justice issues and fairness issues in the allocation of the vaccine.
Professor Diane Hoffman is the director of the Law and Healthcare program at the University of Maryland Carey School of Law. She says whether or not a workplace can require you to get the vaccine is a complicated question.
Vaccinations as well as health screenings are considered medical examinations under the Americans with Disabilities Act. And so that to comply with that law, the vaccination has to be job related or a business necessity.
Places like schools and healthcare facilities can require employees to get vaccinated, but there are still reasons why people could qualify for an exemption.
Sincerely held religious belief that would that opposes vaccines, then the employer would have to accommodate that as long as it wouldn't impose an undue burden on the employer. Also, if the employee had a medical condition where their doctor believed that they would be at risk, it would be unsafe for them to get the vaccine.
There's a federal law called the PrEP Act that was put in place this February. It protects distributors and manufacturers of medications and vaccinations.
That law immunizes those distributors and administrators of the vaccine from individual liability under state and federal laws.
Health experts are adamant that although the 95% effective Pfizer vaccine is getting moved through quickly, they still feel that it's safe. Lieutenant Governor Boyd Rutherford stressed the importance of getting the vaccine when it's available.
Those who even say that I don't want to be the first one, well, you're not going to be the first one, okay? By the time we get to everyone, including us, it'll probably be the spring if we're fortunate.
If the Pfizer vaccine passes through that panel on December 10th and the FDA approves it, it'll start going out to our frontline healthcare workers and the residents at our long-term care facilities as well, and the people that are working there. On Tuesday, the governor said he believes our state will get about 155,000 doses in the first phase. Live in downtown Baltimore, Eddie Kadam, WMAR2 News.